I think on some levels, when we started the family health team, we were very, we made some very conscious decisions at the start about the sort of model of care that we wanted. As we were seeking physicians to join us at the start, and throughout, we've always been very careful that we're looking to people who we know have demonstrated an ability to be collaborative. We have a number of physicians who work in our team who actually trained with us as residents, so we know them, and we meet regularly to continue to talk about that, you know, as an interprofessional group, you know, just to sort of be sure we understand the scopes of practice of everybody on the team, and that when particular types of patients or conditions or community resource issues come up, we're able to sort of be flexible and think about how those things would be best met by the skill set of everybody on our team.
The City of Lakes Family Health Team was founded on the principle that if you are a resident of the City of Greater Sudbury, you ought to have access to a primary care team. The City of Greater Sudbury is the largest municipality in all of Ontario. It's about 3,600 square kilometers. Hence the name, the City of Lakes. In fact, within our city we have 330 lakes. That speaks to the sheer size of the geography. So we knew from the very beginning 10 years ago that building clinics in outlying areas was critical in terms of accessing the needs of our community. And today we have 4 clinics, one actually in the heart of the community, but 3 other clinics situated in outlying rural areas of Chelmsford and Walden and Velcarin. And today we have a team of about 17 family physicians supported by a team of interdisciplinary care providers providing services to over 20,000 patients and growing. So it really does meet the needs and the character of our community. So our partnership with the City of Greater Sudbury and the Health Sciences North, our local hospital, and the Northern Ontario School of Medicine. These are partnerships that really helped to advance this vision, and to this day continue to be very important in terms of how we function.
The Family Health Team is big on taking in learners from the community. We have a good relationship with the Northern Ontario School of Medicine. We often take medical students as well as medical residents and other allied health learners such as nurse practitioners.
When we talk about a team, what we're talking about is a mixture of family physicians and nurse practitioners and registered nurses and RPNs and pharmacists and social workers and dietitians, all working in a very collaborative way to provide services to our patients.
I'm Ashley Hurley. I'm the registered dietitian here. So I would receive a referral from the patient's physician. So we use an electronic medical record here at the Family Health Team. Mostly I do one-on-one counseling. We also do some programs in the evenings like our Craving Change program. And we're also using tablets when patients come into the clinic to do screening for things like malnutrition or nutrition concerns in our pediatric clients.
My name is Kristen. I am the social worker at the City of Lakes Family Health Team. I provide counseling and treatment to our patients. We offer a client-centered approach to care. I work collaboratively with the other allied health professionals and with our family physicians in offering the best treatment plan for our patients.
My name's Megan and I am the Quality Improvement Decision Support Specialist. The Family Health Team is committed to improving our patient care. We do regular annual patient surveys to engage our patients to see what they would like to see us improve. One of those improvements was our recent appointment reminders and online appointment cancellation, and we hope to offer our patients online appointment booking in the new year. So our EMR is a huge database of information, and we use that to plan quality improvement. So we can identify patients, say, who need diabetes and connect them with our diabetic educator, or if you're due for preventative care, we'll often call you to remind you.
My name is Mark Palumbo. I'm a patient here at the City of Lakes Family Health Team. I am very thrilled about the Family Health Team for a number of reasons. They combine their efforts to make your care the very best possible. They're about to launch clinic-wide this Health Myself patient portal, which will allow me to book appointments, just online, without calling the office. And also at some point be able to message my family doctor where appropriate. That's a huge advantage and something that I think will really speed up the process and make it even more efficient than it already is. They have embedded within the family health team care coordinators that will help you with all your home care needs. If, say, you have an accident and you need help with home care, they can coordinate that from the clinic here, and that's a huge advantage.
Robert Lapointe, Telemedicine RPN for City of Lakes Family Health Team. In order to increase quality of care for our patients, all 4 of our locations are equipped with OTN telemedicine video conferencing systems. This allows for our patients to avoid unnecessary travel, as well to decrease wait times in order to see a specialist. We also run programs through telemedicine. We're running an exercise program for patients here called Soup to Tomatoes. It's an armchair-based exercise program. Currently, our OTN program has over 1,000 encounters per year.
My name is Sandy Teagle, and I'm a registered nurse here at the City of Lakes Family Health Team. We offer many programs and services that we feel are really important topics for our patients. Some of them are smoking cessation, diabetes, geriatrics, immunization, hypertension. We have a one-time hypertension class that runs several times a year, and through that class we discuss topics like the long-term effects of hypertension. We talk about basic medications for hypertension and also the benefit of self-management and lifestyle changes on blood pressure. So through that, the patients can set goals and be motivated to help work through their hypertension program.
The vision for the City of Lakes Family Health Team really came from Dr. Chris McKibben and Dr. Tom Crichton were really the 2 founders of the City of Lakes Family Health Team more than 10 years ago. And it's that vision that has really driven this organization and has been carried on by a really committed board of directors. And our board is made up of community members, it's made up of doctors, it's made up of volunteer representatives of different healthcare disciplines, and it's made up of patients.
One of the areas we're most proud of that we've worked hard to develop is a very clear, focused discharge follow-up program. So what we've done is we've organized a program where any of the patients that we're involved with in providing care who are being discharged, the physician who is leading that discharge will organize a very prompt summary of the care that was provided to the patient while in hospital, and we will generally also ensure a follow-up phone conversation with our nurse and perhaps with our pharmacist. The prompt follow-up from the nurse, which usually happens within 24 hours, is also very useful, and I think patients have quite valued because it's a connection then with the practice to sort of check in right away, almost having left the hospital.
So my name is Yolanda Thibault. Both myself and my children come here. Probably about a month ago or so, my mom who also comes here as well, she was hospitalized. The doctor that she did have, because of the rights of the hospital, was from here. And everybody was on the ball with it. So she had her doctor go to the hospital, see her. We had phone calls. When she was discharged, everything was great. They followed up with her. So I think just that, again, that's that reassurance that knowing when you're coming here, you're being looked after by everyone. You know that when you call, someone's going to see you or they're going to take the time to call you back. The team emphasis here is huge, and I think that's what makes it so unique and such a great positive experience when you come to your physician.
I think that what really sets our team apart is the relationships on the team. So it's our relationship with our patients, it's our relationship with each other, and how we collaborate and the kind of care we provide. I think it speaks to the future of primary care, not just here in Greater Sudbury, but across the province of Ontario, so that the manner in which we cooperate, not just with our teammates, but with other partners in the community. Because from the patient perspective, it's all about that big, hairy healthcare system that they're still trying to figure out and navigate. But we have an important role in that. And I think part of that role is to connect patients with resources out in the community that address their priority health issues. And I think that's the real value of family health teams. And the City of Lakes Family Health Team will continue to grow in Greater Sudbury with the view that over time patients in this community will have access to a primary care team. That's the role of primary care. It really is to be the medical home for patients. And I think family health teams represent not just the present, but the future of primary care in the province of Ontario.